Okay, we're going to be looking at the basic anatomy, and this is the foundation of what you need to get down and fully understand. And I know it looks like an awful lot of vocabulary, but if you get it down now, it will make the rest of A&P so much easier, because the terminology we use right now, this is the foundation, and you're going to see it over and over and over again. And yes, we have certain terminology that we use that is not the same as layman's terms. So with the body here, we have other resources that you can look at to get specifics, but a few things I want to point out is that this area right here is referred to, from the anatomical terminology, is referred to as the brachial area. And I'm just mentioning this from the standpoint of why it's so important you start to learn these terms now, is because when you study the muscles, you'll find this muscle is the biceps brachia. When you study the nervous system, there's a nerve that runs through this area that is the brachial nerve. When you study the cardiovascular system, there's an artery and a vein that goes through this area that, oh, guess what? It's the brachial vein, the brachial artery. So if you learn now that the upper arm area right here is the brachial region, it will make things down the road so much easier. And so the best way to study this, personally, I find, is to get a picture. You can make a picture of this model if you want, draw lines on it. Once you've made one copy of it, put it into a plastic sleeve, and then you can label it with markers, erase it, label it again, and just that repetition. That's what's going to help you to learn the various terms. And so we have kind of generalized terms like the thoracic area, upper chest, you've got the abdominal region, the appendages, the legs, the arms. But then within those areas, you also have more detailed terminology, such as the brachial region, the phalanges, or the digital areas for the fingers as well as the toes. So a lot of those landmarks, like I say, you'll have to just learn on your own. We have directional terms that we will use as well, and they're usually in pairs, such as moving towards the head, you are going in a superior direction. If you are moving towards the feet, it's inferior. So how would we use these terms? Well, we also use them for comparison purposes, where you might say, this is the liver right here. The liver is superior to the large intestines, which is right here. It means it's above it. You could also say the intestines is inferior to the liver because it's below it. So that would be moving up or moving down. Medial means towards the midline, towards the middle. Lateral is moving away towards the sides. So the lungs are lateral to the heart. When you are talking about the appendages, just the legs, just the arms, we often use the terms proximal and distal. Proximal means closer to that point of attachment. In other words, closer to the shoulder or the hip, depending on which appendage you're talking about. And distal means further away from this point of attachment. So you could say that the knee is proximal to the ankle, meaning the knee is closer to that hip, that point of attachment. You could say that the wrist is distal to the elbow. It's further away from that point of attachment. Anterior means towards the front. Posterior means towards the back. And then superficial is on the surface layer. And then when we say deep, means you're going more internal into the body itself. We also can divide the body into planes or sections. You cut with planes. There's three main ones. There's the medial plane. Excuse me. That is going to be if you were to cut this way, and you end up with a right and a left side. Another type of section that you can do is the frontal. This is also known as the coronal, and that is where you would be cutting this way. So you end up with the front versus the back. And then the third type is a transverse plane. You can do a transverse section where you end up with a top and a bottom. Which type of section would you do? Those of you who may end up in, say, radiology, you want to do an x-ray, or you want to do an MRI, and you want a certain plane. It depends on the circumstances. What information do you need to get? How do you need to see the organ that you're looking at? That will determine which type of section you will be needing to perform. There are body cavities. We have the ventral cavity and the dorsal cavity. The dorsal is in the back. It is composed of the cranial and the spinal cord cavities. And then the front, we have the ventral cavities, which are subdivided into your thoracic cavity. Your diaphragm is this right here. It is this smooth muscle just below the lungs. And that's a division point. So anything above the diaphragm, right in here, this is your thoracic cavity. In the thoracic cavity, what does it contain? It contains your lungs and it contains the heart. So this whole area here is the thoracic cavity. Below the diaphragm, and here's your abdominal pelvic cavity. And roughly, general point is about the top of the hips across. Below that would be the pelvic cavity. Above it is the abdominal cavity, if you want to further separate those out. Also, within this unit, you need to become familiar with the way we can divide the body into quadrants. The thoracic cavity and the abdominal pelvic cavities combined right here can be divided into 4 quadrants. So you have a line this way and a line this way. They're named very nicely as your upper right quadrant, your upper left quadrant, your lower right quadrant, and your lower left quadrant. Please always remember, when we use the terms left and right, it's not your left and right, it's always the patient's left and right. So on this model, if we are talking about the upper right quadrant, we're talking about this area over here. It's his right and left. You can further subdivide into 9 regions. Those regions, you do need to be familiar with what organs are in which region. That's going to help sometimes. You can't do a diagnosis. Say a patient comes in and has pain, and you say, okay, the pain is in the right lumbar region. It's going to help narrow down because you'll know what organs are in that area. Sometimes we have referred pain where pain's felt in a different area. So you can't make a diagnosis solely on that, but it's going to help. It'll help narrow it down. It can also help you to pinpoint instead of writing in your notes for another, whether it's another nurse or the physician, oh, the patient felt some pain in his abdomen. Well, where in the abdomen? Let's pinpoint it down to a smaller region. Is it down here? Is it in the middle? Is it further up? More in the thoracic area? Where is it? So it helps, because remember, you're not always face-to-face communicating with other healthcare professionals. You're often having to communicate via written notes. So it just helps to clarify that. There are additional cavities in the body, such as the oral cavity, which is the mouth, or the orbital cavities for the eyes. And we tend to study those cavities when we study that particular part of the body, whether it's vision or the digestive system. So we'll cover those additional cavities at that time.